Your body's trying to tell you something right now. There are warning signs hiding in places you'd never think to look. On your earlobes, your fingernails, even in the corners of your eyes. And these aren't just random marks or age spots. They're your heart, literally calling out for help. See, heart disease doesn't always show up as chest pain or a dramatic heart attack. Sometimes it whispers through tiny changes in your skin, your nails, your eyes. And most people, they completely miss them until it's way too late. So what if I told you there are 13 visible signs you can check yourself right now at home? Signs that could genuinely save your life or someone you love. The title of today's video is 13 Signs of Heart Disease You Can See. Doctor explains. And on the thumbnail, you saw heart disease. In this video, I'm going to walk you through all 13 of these warning signs step by step so you know exactly what to look for and when you should take action. Look, heart disease is one of the most common conditions out there. And the scary part? It develops quietly. A lot of people have no clue anything's wrong until they're facing something serious. But here's the thing. Your body often gives you clues way before things get critical. And these clues, they show up on your skin, in your eyes, on your nails, in surprising places. So today, I'm going to teach you how to spot these signs so you can catch problems early. Let's jump in. Alright, first up, something called Frank's sign. It's this diagonal crease that runs across your earlobe, and it might be telling you something about your blood vessels. So, why the earlobe? Well, it's actually one of the only spots on your body with no fat, just skin, fed by these incredibly tiny blood vessels. When you start seeing premature wrinkling or creasing here, it's a sign those little vessels might not be doing so great. And here's what's concerning. If the blood vessels in your earlobes are showing damage, chances are the same thing's happening in your heart. Now, I gotta be honest with you, this one's a bit controversial. Earlobe creases do get more common as we age, naturally, which makes it tricky. So, when should you actually worry? Here's the key. Look for deep creases that run all the way across both earlobes. That's when it becomes more significant. But my take? Frank's sign isn't a diagnosis. Think of it more like a conversation starter, a reason to talk to your doctor about your heart health. Okay, now let's look at your eyelids. See those flat, yellowish patches near the corners? Those are called xanthelasma. And basically, they're cholesterol and fat sitting under your skin. Here's what's going on. When your cholesterol gets too high, it starts depositing into your tissues. And your immune system? It sends these cells called macrophages to clean it up, literally eating the cholesterol. But when they eat too much, they turn into these bloated foam cells. So, when you see xanthelasma, you're actually looking at clusters of these overloaded cells. Now, why does this matter for your heart? Because the same thing happening on your eyelids is probably happening inside your coronary arteries. Those foam cells build up into plaques that slowly block blood flow to your heart. I had a patient once, just 40 years old, came in with chest pain during exercise. The second I saw her face, I knew something was really wrong. She had so much xanthelasma, it looked like she was wearing glasses made of cholesterol. We actually call that pseudo-spectacles. She also had these huge lumps on her hands and feet, tuberous xanthomas, another sign of cholesterol buildup. Turns out she had this genetic condition, familial hypercholesterolemia. Her cholesterol was dangerously high, and by 40, the plaque in her heart was so bad she needed open heart surgery. And here's what surprises people. Even if your cholesterol tests come back normal, xanthelasma still raises your risk of heart disease and death. Research shows that. So, if you see these yellowish patches, don't ignore them. Talk to your doctor about genetic testing and how to lower your risk. While we're on cholesterol deposits, there's another spot to check. Your eyes. Look at the colored part, the iris. Do you see a grayish or white ring around it? That's called corneal arcus. Now, almost everyone develops this as we get older, so it's not automatic panic mode. But timing matters. If this ring shows up before you're 45, that's a red flag. You need to get your cholesterol checked. Early corneal arcus suggests something's off with how your body's handling cholesterol, and that deserves attention. Alright, so your skin can tell you a lot, but it's not always about cholesterol. These bumps around the eyes, they're linked to conditions called amyloidosis. The most common type is AL amyloidosis. Your bone marrow starts making tons of these misfolded proteins called amyloid, and these proteins clump together and deposit into your heart muscle. This makes your heart stiff and thick. We call it restrictive cardiomyopathy. Early diagnosis here is critical. You don't want to wait for heart failure symptoms. That's why spotting these skin signs is so important. So start by checking your skin for waxy, translucent bumps. They feel firm. You'll usually see them around the eyes, ears, and neck. Next, look at your tongue. Amyloid can deposit there too, causing it to swell. That's called macroglossia. And here's a trick I use. Look for indentations along the sides of the tongue. As it gets bigger, it presses against your teeth, leaving those marks. And finally, watch for raccoon eyes. This dramatic bruising happens because amyloid weakens your tiny blood vessels. So even just rubbing your eyes gently can make those vessels break and cause serious bruising. Next, let's talk about livedo reticularis. It's this net-like, lacy pattern on the skin, a sign of poor circulation. The reddish-blue pattern happens when certain blood vessels get constricted or blocked, while the rest of your skin looks normal. But here's the thing, it's not always bad. Actually, it's super common in healthy babies, or even young women when they're cold and their blood vessels constrict. The key? It doesn't hurt, and it goes away when they warm up. On the other hand, it could mean small pieces of cholesterol plaque broke off in your arteries and got stuck in the tiny vessels in your skin. That's called a cholesterol embolism. But that's not the only concern. As a rheumatologist, I see this in serious autoimmune conditions like lupus or antiphospholipid syndrome. So here's the rule. If this pattern shows up and doesn't go away when you warm up, especially if there's pain or skin ulcers, you need to see your doctor. Okay, now look at your fingernails. See any pulsations? Little color changes with your heartbeat? That's Quink's sign. Normally, your heart pumps blood out through a one-way valve, the aortic valve. But if that valve gets leaky, blood flows back into your heart between pumps. We call that aortic regurgitation. And when blood flows backward, it causes a rapid pressure drop, which creates these visible pulsations. And it's not just your nails, you can see pulsations all over. Corrigan's sign, where the carotid arteries in your neck are literally dancing. De Musset's sign, a subtle head nod with each heartbeat. Mueller sign, where you can see the uvula in the back of your throat pulsating, which, I gotta say, is pretty wild. And Landolfi sign, where your pupils shrink and grow with every heartbeat. If you don't treat aortic regurgitation, it puts massive stress on your heart, and eventually, it leads to heart failure. Heart failure is when your heart gets damaged and can't pump blood effectively anymore. This can happen if the heart muscle gets too weak, like after a heart attack, or if it gets too stiff, like with amyloidosis. Now, one of the most obvious signs, swelling, called pitting edema, usually in your feet and ankles. But don't be fooled, this doesn't always mean heart failure. Here's a simple test you can do yourself. Press your finger firmly into your shin or ankle for about 5 to 15 seconds. If it leaves a visible dent, that's pitting edema. So, why does this happen in heart failure? Well, when your heart can't pump well, fluid backs up in your body. Think of it like a car accident causing a traffic jam. You get congestion on the highway, so people start exiting to avoid it. Same thing in your body. Fluid backs up, pressure builds in your veins, and fluid starts leaking into your tissues. If it gets severe, pitting edema can cause skin breakdown and infections. But it's usually not life-threatening.
However, the main reason I admit patients with heart failure, when fluid builds up in their lungs, it's called pulmonary edema, and it looks really striking on a chest x-ray. When your lungs fill with fluid like this, the most common symptom is orthopnea. That's shortness of breath that gets worse when you lie down. It's actually super common for patients to tell me they've started sleeping in a recliner because it helps them breathe better. Good news though, we have really effective treatments. In the hospital, with close monitoring, we can use meds to help someone pee out 10 to 20 pounds of fluid in just a few days. But heart failure doesn't just affect your legs or lungs. The increased pressure in your veins can damage your kidneys and liver too. And people are usually shocked to learn heart failure can lead to cirrhosis, even liver failure. There are tons of physical signs when your liver isn't working right, from belly swelling to skin and nail changes. All right, another test for you. Put the backs of your nails together like this. Can you see a little triangle of light between them? That's normal. But if you can't, that's digital clubbing. It's usually a sign of chronically low oxygen levels. But it can also come from things that cause abnormal tissue growth in your fingertips. Lots of causes. Chronic lung disease, bowel disease, and yeah, heart disease. The most common heart causes are birth defects, usually picked up in childhood. But when I see clubbing in an adult, it makes me think of an infection in the heart called infective endocarditis. Infective endocarditis usually means an infection on your heart valves. If certain bacteria or fungi get into your bloodstream, they can latch onto your valves and form these little clumps. We call them vegetations. And these vegetations are literally flailing around on the valve as it opens and closes. So if you're thinking that sounds dangerous, you're right. Little chunks can break off and travel through your blood until they get stuck in tiny vessels. If they lodge in your fingers or toes, they cause these painful bumps called Osler nodes. Or they can cause flat, painless spots on your palms or soles, Janeway lesions. And maybe the most recognizable sign? Splinter hemorrhages on your nails. These reddish-brown streaks look like wood splinters, but they're actually tiny blood clots in your nail bed. Now, seeing a splinter hemorrhage doesn't always mean endocarditis. But with endocarditis, you'll usually see splinter hemorrhages on multiple nails, plus other symptoms like fever, weight loss, or just feeling really unwell. Okay, when's the last time you felt your pulse? Take a second. Check the rhythm. Does it feel regular, predictable, or completely random? There's one cardiac arrhythmia that's so important to catch, many smartwatches are designed to alert you if they detect it. It's called atrial fibrillation, and it causes a random, irregular heartbeat. So if you or someone you know has an irregular heartbeat, even if it comes and goes, get it checked out. AFib is easy to diagnose on a heart monitor, and treatment with a blood thinner can dramatically lower your stroke risk. So if you're feeling motivated to improve your heart health after all this, as always, stay curious, stay healthy, and I'll see you in the next video. Bye for now.